Rationale of the Decoding webinar. I am Trenda Davis, and I will be the presenter for today. In this webinar, we will discuss orthoscopic procedure of the knee arthroplasty, which we will include uni-arthroplasty, total arthroplasty, revision, ligament repair and reconstruction of the knee fracture and dislocation, and throughout the webinar, we will discuss the diagnosis coding, acute versus chronic, and proper diagnosis used for fracture and dislocation. In your coding for the knee, we need to remember the knee has 3 compartments: medial, lateral, patellofemoral, superior patellar, or may be referred to as anterior. Let's start with orthoscopic coding of the knee. CPT code 29875, Synovectomy, limited, 1 compartment. CPT code 29876, Synovectomy, 2 or more compartments. CPT code 29875 is considered a separate procedure code. This means that this procedure is inclusive to a more extensive procedure performed in the same anatomic site, and it is not separately billable. However, many providers want to bill synovectomy when they perform a meniscectomy. However, per AAOS CPT 29875 and 29876 should not be reported when provider is performing a synovectomy for only cleanup in the joint while performing a more extensive procedure. The provider would need to document medical necessity with a supported diagnosis. Here are a few common diagnosis codes that would be approved to bill a synovectomy with a more extensive procedure. Diagnosis code M06.869, other specified rheumatoid arthritis, unspecified knee, M05.069, Felty syndrome, unspecified knee, M08.069, unspecified juvenile rheumatoid arthritis, unspecified knee, M12.269, villodural synovitis, unspecified knee, M25.869, other unspecified joint disorder, unspecified knee. Let's look at an example. The patient has a lateral bucket handle tear and synovitis. The surgeon performs a lateral meniscectomy and a medial compartment synovectomy. The CPT code that should be reported is 29881. The rationale is CPT code 29875 can't be reported with any other orthoscopic knee procedure on the same knee in the same session. You can only bill 29881 in this example.